thanks for taking the time to come and hear about the program, the work that we do, the impact that we have, and how people continue to support this work. So again, I thought it would be helpful to start by just kind of talking about what this program, the PDP, is about. So the Paediatric Developmental Program, or the PDP, it's a multidisciplinary health and wellbeing program for children from rural and remote areas of New South Wales. As Jackie said, these children have complex needs and they have limited access to these services locally. The program is co-funded by the New South Wales Government and Rural Far West, and it's free for these families that are from these areas. As you can see, there's three main components to the program. Of course, there's the assessment component, building capacity and connecting to care. As Jackie said, we really partner with children, families, local schools and services, and we see the importance of doing that. Our team of clinicians and doctors assess and figure out what's going on, what's working and what's not working with the child's body, emotionally in their relationships, in their understanding and communication, and what's impacting their learning, behaviour and play. We are a specialist service. We have expertise in supporting complex presentations, complex little kiddos, and we're really, really trauma informed. Some of our underpinning principles are around being really family-centred, which means that we understand the importance of parents, carers and communities around the child and the important role that they play in their lives. So our assessment is also really not just about the child, it's about the whole family. This is the PDP pathway or journey through the program for our families. Each of the circles that you can see represent a stage or an assessment week within this program, and each of the assessment weeks are incredibly comprehensive. As Jackie mentioned, our program in particular has been significantly impacted by COVID. As Jackie mentioned, our program has been predominantly face-to-face for many, many, many years. And when COVID-19 hit, we really had to think about how we continue to deliver a service for these families that couldn't access our face-to-face program. And the way we did was to pivot to telecare, which is what we refer to essentially as an online mode of delivery. And I guess just to give you an example of what we were offering pre-COVID online. So in 2019, we'd offer about 50 appointments via telecare a month. And in 2021, that went up to over 500 appointments a month that we were delivering via telecare. And at the height of COVID, we were able to deliver 80% of that comprehensive allied health service via telecare. Fast track to now, we have been able to maintain a significant online component of the program, in addition to the face-to-face component of coming to Manly or us going into community, so going on outreach. And I guess this has had a really positive impact on our families because it just means that our service is more accessible, it's more flexible and responsive to the needs of the individual family and client and what's going to work best for them. Majority of the clients we have seen in the last 2 years have really been impacted by COVID. So therefore, the amount of children waiting to come down to Manly has grown. And as a result of that, also the children waiting to complete, to start assessment has grown. And like Jackie said, the need is so unrelenting. At the moment, we get about 45 referrals per month into the program. So you just saw the pathway and Sasha pulled up for me the visual, so what the assessment weeks actually look like and what they involved. And as you can see, the depth of the work we do is significant. The assessments are incredibly comprehensive. You can see up the top line the headings are around the assessment weeks or stages. So you can see that stage 1 and what families might receive as part of that process. The week 2 and again that week is really often face-to-face or in community, and then for some of our families there is a 3rd week, and as Jackie talked about, complexity is increasing and therefore many families require that additional week for us to really understand what's going on for the child and family. So I guess a little bit more around increasing complexity. The children that we're seeing, the families that we're seeing, parents are reporting increases in mental health concerns. We're seeing more and more children with concerns regarding their emotional well-being, and the demand for psychiatry is growing in particular. More children who have, or in some cases, are still currently experiencing trauma. As Jackie referred to, more and more children who have experienced an adverse childhood experience. We've got increasing rates of concerns around child safety and risk, and more families requiring that statutory intervention from child protection services. Although we are predominantly on the PDP and assessment program, the scope of the program has really had to increase because of the increasing in complexity and because the access to local services is so difficult. Although we do receive some of this funding from New South Wales Health, the costs aren't enough to cover the work that we do to support our most complex and vulnerable children. And in some cases, supporting our complex families, especially those that are experiencing child safety concerns, maybe double or triple that of a child who might follow a more typical path through the PDP. And this is why we need support to be able to continue to do this work. I thought it might be helpful to illustrate an example of complexity versus perhaps, like I said, a more typical child coming through our program. So client A, typical pathway through the PDP, undertaking an intake and 2 assessment weeks with us. They also had some additional appointments by way of dietetics and psychiatry. Over the course of 6 months, Royal Far West clinicians recorded 45 hours, it's quite a lot, hours of direct work, and an additional 39 hours of indirect work, which includes follow-up, case management, liaising with school, liaising with local services. Client B is also participating in the PDP. This client is one of the many children whose clinicians have been advocating directly with child protection services for greater involvement. The clinical team continue to make recommendations and consult with local services around how to keep this child and this family safe and the interventions that they might need to be able to do this. Since this child's referral in 2019, the client B's clinicians have provided over 90 hours of direct service and an additional 147 hours of indirect care. And this child has not been discharged from our program, so the work that we're doing is still ongoing. And as you can see, that increase of 280% for this particular child. What we know is the impact we have. At the end of this assessment process, feedback from many of our parents and carers is that this is often sometimes the first time in their child's life where they feel that they have the whole picture, a clear picture of their child and what's going on for them beneath the surface. Many of our parents will talk about the impact that that's had. Many of our parents will say, now we really understand. It's not our poor little boy's fault. He's not naughty, and it's not our fault either. And you can just imagine the sense of relief that brings to many parents. We know that our parents and carers are often the greatest advocates for these children, for their future, and they're often their greatest warriors. They're armed with knowledge, skills, connections with services, therapies, and support for the future, which is really life-changing stuff after they complete the program. And we know that this work that we do is so important. It makes a significant difference and has a positive impact on our clients' lives. We hear this repeatedly from parents and carers and clients and schools and local services, and we see this through the work that we do when they're here. But we need help to be able to continue to do this.